My name is Dr. Hillel Mazansky, and I specialize in medical hypnotherapy, guided visualization, nutrition, and exercise. My website being gianinc.com. Today's health tip is entitled Snoring. It's not that simple. Snoring, millions and millions of people snore, even children snore. The cause of snoring in children is when their tonsils are enlarged, and the snoring in adults is when the airway collapses on itself, and then when you exhale, it's exhaling through an obstruction and it gives that loud noise. Now, plain and simple, snoring is not that serious. When snoring does become serious is when there are periods when you stop breathing during your sleep. And those periods are periods of apnea. And the condition is then known as sleep apnea. Sleep apnea can be extremely dangerous as it can lead to heart attacks, strokes, and high blood pressure. It is in particular the obese people and people with circumference of their neck of 18 inches or more that can be affected. Of course, the person who sleeps doesn't hear themselves snore, and it's up to their partner who sleeps next to them to tell them that they snore. It is important to find out from your partner if you stop breathing. Those people who have periods of apnea, the next day they feel very tired because they have not had a good night's sleep. They stop breathing while they're sleeping, and this interrupts their sleep, leading to tiredness the next day. The people can fall asleep even driving, or just sitting in a chair in a restaurant, or sitting in a movie, they fall asleep because having not had a good night's sleep, they snore. If you live by yourself and you think there might be a chance that you do snore, what we suggest is that you put on a recording machine and let it play while you are sleeping. And if you hear that there is a break in your breath, that you stop breathing, it is important to go to your doctor for immediate diagnosis. How is sleep apnea diagnosed? Basically, there are two types of sleep apnea. The one is obstructive sleep apnea, which occurs the most often and most frequent, and then there's central sleep apnea, which comes less frequently, where there's some abnormality in the brain. Either way, both types of sleep apnea need to be treated. But first, before the treatment, is the diagnosis. The way it's diagnosed is you see a respiratory or lung specialist, and they attach a small instrument to your finger and to your chest, and you sleep with that machine during the night, and then the following day you take it back and they can analyze if you've had periods of apnea or hypopnea. However, on occasions, those tests are not conclusive. In that case, you need to be admitted overnight to a sleep facility where you undergo a very, very comprehensive sleep study with multiple leads attached to your brain, to your nose, to your mouth, to your lungs, to your heart. And after you sleep overnight in one of those facilities, the diagnosis is made for sure one way or the other. How do you treat sleep apnea and the snoring? Well, first off, if you are overweight, it's very important to lose weight. To do that, you can go on my website, gianinc.com, hit the nutrition icon and read all about the tips that I give you there, and also go on to the nutrition blogs. And if you follow that, you will certainly lose weight. Weight loss, if you're overweight, is of prime importance. Aside from that, you have to use a special apparatus at night, and you have a mask. It's either a mask or it can be tubes in your nose that when you sleep and you stop breathing, this machine pumps the oxygen into you and starts you breathing again, and you don't have the sleep apnea. After 2 or 3 days on the machine, you will feel very much better. There are other treatments for sleep apnea. There's mouth apparatuses that you see a special type of dentist who deals with this, and they make you a mouth apparatus and prevent your soft palate from falling over and covering your trachea. So there are various types of treatment that are available. The important thing is, if you suspect you have sleep apnea, go and see a doctor, have the diagnosis made, because the consequences of sleep apnea, as I said, are heart attacks, heart disease, stroke, high blood pressure, and those can be deleterious to your health. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.